Hey everybody, welcome back. Dr. Michael Miyazaki again, and today we're going to talk about restorative dentistry. Back to the Regen materials that are bioactive, but today's we're going to focus on a bulk fill composite that can be used as a composite for direct restorations, can be used as a core buildup material, so it has strength, but it has a thin enough film thickness where you can actually use it as a resin cement. So it's a very versatile material. And what makes it stand out is that bioactivity, because we all know there's a plethora of bulk fill materials out there, but none of them have that bioactivity. Once again, the Bioglass 45S5, which was developed over 50 years ago, when you put Bioglass 45S5 into the body, it actually creates hydroxyapatite. And so if they put Bioglass 45S5 on a bone, that ceramic turns into bone that cannot be taken off. I mean, it actually grows bone. So you have this additional exchange of calcium phosphate and in the oral cavity fluoride that helps to protect our restorations, our teeth, but it helps to maintain that tooth restorative material interface. So the Bioglass 45S5 can neutralize acidity, and in that alkaline environment, the bacteria is not going to be able to grow like it would normally proliferate in a more acidic environment. So by having a material that's bulk fill, and I know a lot of you like bulk fill materials because of the no shrinkage stress, it's self-cure, you don't have to worry about depth of cure, and if it can be used as a restorative, a core buildup, and a cement, and be highly versatile, why would we not use this? But when you put the 45S5 Bioglass in there, it extends the longevity of our direct and our indirect restorations, which we're able then to maximize our patients' oral health care, just their overall dental health. And I think that's why we're looking to use the best products all the time so we can do that for our patients. So you may have seen this before, but in this video we have a beaker, and this beaker has a pH indicating solution in it. When the beaker is pink in color, we have a basic pH. When it's yellow in color, we have acid or acidic pH. So we are going to add acid to this beaker. And what you'll see is the solutions go for pink for basic to yellow, which is acidic. But now look what's happening on the left-hand side. It's turning pink again. Why is it turning pink? Because it's going basic again. Well, how could it go basic? On the right-hand side, we have your normal composite fillers. On the left-hand side, we have Bioglass 45 as our filler. And so again, you add the acid, it goes from pink to yellow, and the left-hand side goes back to pink because the pink has the Bioglass 45S5 filler material, and the right side just has your normal composite. So that Bioglass 45S5 is doing that acidic buffering, which is very advantageous. As I mentioned before, our restorations are going to be better protected, and the Bioglass will actually create a more alkaline environment so that we don't get bacterial proliferation. And then this experiment shows discs of composites. The composite on the left-hand side is regular composite, the inert resin. Basically, on the right-hand side, we have discs that have Bioglass 45S5. Now, remember I talked about that. The calcium phosphate exchange is enhanced with the Bioglass 45S5. So these discs of composite are suspended in artificial saliva. So it has the minerals like saliva would have, and it's being stirred for 2 weeks. At the end of 2 weeks, you take those out, you rinse them off, and the disc on the left-hand side, which has no bioactive glass in it, you can see it's just clean composite. On the right-hand side, it has this orange peel effect because the calcium and phosphates were attracted to that material, and so it has that little texture. Now, that's not a bad thing, but that is just proof that we can attract calcium and phosphates to our composite or a restorative material when we have the Bioglass 45S5. Now, you take these two properties together, and that's kind of what this study by Dr. Nate Lawson showed, where they had an artificial caries model on extracted teeth to see what would happen if they took these teeth, they cut little window preps at the DEJ, and what they did is they filled that up with composite. Now, they used a bioactive adhesive with a bioactive composite, a bioactive adhesive with the regular composite, a regular adhesive with a bioactive composite, and then a traditional adhesive with a traditional composite, just to kind of see what would happen. So he took these teeth and he cycled them for 30 days for 1 month, where he put them in a demineralization solution, more acidic, for 4 hours, and then put them in a remineralization solution for 20 hours, and did that for the month, pulled them out after a month, sliced them in half, and then looked with SEM at that interface where the material and the tooth actually came together. And what would you expect? Well, if I had the Bioglass material and it could attract calcium phosphate and fluoride with that exchange right there, and it could reduce the acidity, would we not have a better margin than one that was placed in acid basically and had no protection? So on the graph here where you see the green bars, that is where at that restorative uh, tooth margin, we had no breakdown of the margin. And the red bars show areas where the margins did break down a little bit. So let's look at the tall green bars. The first one is where we had the Regen adhesive with the Regen composite. So that had the best results. The next one down had the Regen composite with the regular adhesive, traditional adhesive. So that was the second green bar. Now, the shortest red bar is when you had the Regen adhesive with the traditional composite. So what's happening here? Now, the composite with the Bioglass 45S5 is your reservoir of Bioglass. When you have the adhesive layer, which is very thin, we have some Bioglass there, but we don't have much. So we got a little bit of protection, but not as much as when we had a lot of that reservoir of Bioglass 45S5 in our composite. So it just goes to show that you get the best results using a bioactive adhesive with a bioactive composite. Next best was a traditional adhesive with a bioactive composite because they had that pool of Bioglass 45S5. The fourth bar over, which is the plunging red line, is when you had your traditional adhesive with your traditional composite. And why is that? Because like we saw on those discs suspended in that artificial saliva, there's just no protection afforded to that area when exposed to acids. So that is the importance of having Bioglass 45S5 in our restorative materials. And that's how the Regen suite of materials has been built. So the Regen Bioactive Bulk Fill Composite is a bulk fill dual cure methacrylate based material containing that Bioglass 45S5. And being that it is a dual cure means that you don't have to worry about the shrinkage stresses because you don't have to use a light to cure it completely. You don't have to worry about depth of cure because it will cure in the dark basically by itself because it doesn't require the light. It has a base and a catalyst reaction. You can use this for all your direct composites. You can use it for cementation of your indirect restorations, and you can use it for your core buildups. So it is very versatile and it has an exceptional antimicrobial protection because it has Regen. Now with the Regen adhesive, which is the one that I use, we're able to put the Bioglass 45S5 right into the dental tubules, and that's what I want to do. I want to help the tooth heal below the wound, which is basically where the filling is. So I'm going to do my prep, then I'm going to open up the tubules, I'm going to place my bioactive adhesive, so the Bioglass 45S5 is getting into the tubules, and then I'm going to place this pool of bioactive material over the top of that, which is the rest of the prep. Now, Dr. John Kenka, who was instrumental in developing the Regen Bioactive materials, said that bulk fill materials can be a tremendous time saver. The key to these materials is their ability to mitigate contraction stresses, cross-link to your adhesive, and provide acceptable aesthetics. The Regen bulk fill delivers antimicrobial protection and contains Bioglass and other bioactive components that promote healing and prevent recurrent decay in direct and indirect restorations. So the Regen bulk fill is a fantastic choice that checks off all the boxes of having kind of an ideal material. Now, this is IFUs, instructions for use when you're doing a composite fill-in. I'll just go over it very quickly. You isolate and prepare the tooth. If you're going to use a bioactive composite like the Regen Universal Adhesive, which is the one that I use, or the Regen Self-Etch Adhesive System, that's great. If you're not going to use one of those bioactive adhesives, just make sure that your adhesive is one that's recommended to use with the self or dual cure composite restorative material. The next thing is to bleed the bioactive bulk fill composite resin cement syringe because it has two barrels. You want to express a little bit out because you want to make sure equal amounts are coming out both sides. I then attach it to the gun, and the gun is a dispensing gun. And what you do is you want to make sure that as you slide that syringe of the bioactive bulk fill material in, that you slide it all the way into that groove, because if it doesn't go all the way to the other side of the gun, you can't express it out. So I'm going to show you, when you look at this, you can see that it is all the way into that groove. That's what you want. So now the plunger can enter both of the tubes. Take off the brown mixing tip and express just a little bit out just to make sure that we have the base and callus coming out together. Then put your mixing tip on, and if you're going to be placing like your direct restoration, we even have a small intraoral tip that will help you get this material deep down into the deep part of the box. Fill it from the box up so you don't incorporate any air. So we want to make sure we keep that tip embedded in the material as we express it out. We draw it up until the whole box is filled up. Then what I like to do is take an Explorer and draw the material towards my margins. If you want to get this going a little bit faster, you can just activate it just for a few seconds to kind of set it. A lot of times I just let it set, because if I let it set, I don't have to worry about the shrinkage stress. You can see right here, as it was setting, I just carved in my anatomy. That's what it looks like before I've taken any burrs or polishes to it. And we have anatomy in there, and it looks very shiny. So that's the way I do my direct composite restorations. It's just very fast and easy. If you're going to do your cementation, basically you don't have to use that intraoral tip. You can just have the mixing tip. I express out the cement into my restoration like a crown typically, then seat that, push it down all the way, and then I come in with my curing light and cure for about 3 seconds around the buccal and lingual side, and that gel sets my cement. I peel that gel set cement off. I floss interproximally, and then use my interproximal carver to remove any bulk areas of cement that still might remain. Then I get in there and I light cure very thoroughly. And again, if you have a restoration that perhaps it's a PFM that light can't penetrate, you don't have to worry about that, because this is a dual barrel self-curing material. Now, if I'm going to use it for a core buildup, a lot of times what I'll do is I will use it, I'll have my post and everything all ready to go. So I've got my tooth, I've got my post and my crown. So I will go ahead and make sure my post fits into the post base, the crown fits over the top, that the post doesn't impede the full seating of that crown. Then I'll go through my etch, my adhesive placement into the root and the root canal area where my post is going to go. Then I put that little intraoral tip on. I express the cement into my post base. I place the post. I hit that post now for 3 to 5 seconds so it can't move, so it's set. Then I take the gun with the same mixing tip. It will not have set yet, and I fill up the entire core around that post and between any remaining tooth structure that's still there. And then if I know my crown is going to fit, I fill my crown up with cement, and I push that down over the prep, over the post. Then I do the same thing. I light cure for a little bit, and then remove the gel set and do my flossing. Or if you just want to do a regular core buildup, you can place your post, or if you don't need a post, just place this material after you've etched and placed your adhesive into the tooth. Apply this material, and again, you don't have to worry about the light penetration because it's dual cure. So if you've got a really deep, let's say, core, you fill that center area of the tooth up, you let it set, you can light cure the outside, because many times we don't have to worry so much about the shrinkage stress because we're missing walls of the tooth. It's filling up and replacing walls. And then cure it. And then if you don't have the crown ready to go at the same time, just go ahead and prep it. The buildup material will cut just like dentin, so it's very easy to cut. You have control. You can get it very nicely contoured with your burr, and then cement over the top. So again, you can do your bulk fill direct restorations, you could cement your indirect restorations, and you can use this as your core buildup material. So it's ideal for class 1, 2, 3, 4, 5 restorations, cementation of post and your indirect restorations, and it's great for your core buildups. Now, why is it so good at all this? Because of that bioactivity. I tell the patients this is going to prevent recurrent decay. In the past, we've used filling materials that filled up a hole once we removed the decay, but it was just an inert material. It filled the hole. But what could happen over time is we could get a new cavity. This is going to help to prevent that new cavity. And I've had patients tell me that, hey, you're using this great material, I would have paid you more for it. And I tell them, luckily you're not today, because we just try to use the best materials we can as if you were a member of our family, and I don't want you to have to do this again. So it comes as a kit. We've got the bulk fill material, and it minimizes the shrinkage stresses. It's very easy to use, as we saw in those instructions for use examples. Has unlimited depth of cure, but the kicker is it has bioactivity. If I was going to have a direct or indirect restoration cemented in my mouth, I'd want something that has bioactivity. I'd want something to prevent my restoration from failing. and the Regen Bioactive bulk fill material does that. So it's a suite of materials: universal adhesive, a bioactive bulk fill composite, Pitt & Fisher sealant, flowable composite liner, self-etch adhesive, and a bioactive endo sealer. If you have any questions, feel free to email me, but try the Regen family of goods, and I hope you have some great success. Again, we are a community of like-minded clinicians trying to do the best for our patients. If you like this information, hit subscribe so you don't miss out. And if you really like it, hit like so that it encourages others to sit through this. Just want to say thank you very much for attending today's session. And I hope this helps in the future. Take care.